Osteoarthritis is the most common form of arthritis. It affects about 50% of people over the age of 60, and if you're over the age of 80, you're almost assured to have some form of arthritis somewhere in your body. It's a slow, degenerative disease that takes many years often to develop, and it's often called simply the wear and tear disease. Typically what happens is it's caused by mechanical breakdown of the joints or the structures around the joints, and it typically affects the large weight-bearing joints, and these could be the knee or the hip or the lumbar spine. And it's caused by cartilage, which is the very smooth surface below the joint, the bone ends, that wears away. So if we look at these two pieces of perspex here, which are going to mimic the cartilage, which is at the end of the bone, you can see they're very smooth. Now if we put a little bit of dishwashing liquid in this case, and this is to represent the synovial fluid, which is the fluid between or within the joint and between the two cartilages ends. If we rub this together, you'll see that the joint moves almost frictionlessly. It moves very, very easily. But what happens with arthritis is this cartilage breaks down. And it's a bit like if you got sand and sprinkled that over there, and you see that it doesn't move anywhere near as easily, and in fact you can hear that creaking. And it's often termed with people with arthritis as though they've got broken glass, shards of glass in the joint, because one gives them discomfort, but it's the noise and the cracking around it, and the joint doesn't work as easily. Typically the symptoms that you might first notice is that when you get out of bed in the morning, your joints feel a little bit stiff or a little bit uncomfortable, or if you've been sitting for any length of time that you notice that you're a bit stiff, and it takes you a few steps to get going. The joint itself may become painful, and it can often be localized to the joint, and sometimes it can refer away from the joint. So if you're getting hip pain, you may notice pain down the thigh, the front of the thigh. You may notice swelling in the joint, and typically if you've got osteoarthritis of the knee will be swollen, and you'll see that it's bigger than your knee that hasn't got osteoarthritis. And over time you'll develop things like muscle weakness. You may not notice that as a sudden event, but over time your muscles will end up weak. You may also notice some creaking or cracking when you move the joint, and that's often a first sign of it. And typically if you do prolonged activity, like if you go for a long walk, you'll find that if you've got osteoarthritis of those large joints, they become sorer the more you're on them. There are a number of risk factors around osteoarthritis, but typically it presents in people over the age of mid-40s. If you've increased weight, and we have to be particularly conscious of that in New Zealand now with our increasing obesity epidemic, because increased weight affects obviously the weight-bearing joints such as the knees and the hips. Women are prone to have osteoarthritis slightly more than men, and typically it'll affect their knees and hands. There are some hereditary links, so that if one of your parents has suffered osteoarthritis in one of their joints, you may have a slightly higher tendency to end up with osteoarthritis later in life also. If you've had a joint injury, and that could be through either a motor vehicle accident, something as severe as that, or some sporting trauma to a joint, you may find that as you age, that joint becomes affected. And then there are other specific joint diseases such as septic arthritis, rheumatoid arthritis, or gout, which may lead you to having osteoarthritis in a joint later in life. Typically, it's diagnosed through symptoms and physical examination, and a trained health professional such as your doctor or physiotherapist will ask you what are your symptoms, and it's quite important that you're able to relay what you feel and how you notice that your joint is becoming sore. And then they will, after you've been able to give them that information, they will be able to give you a physical examination where they'll look at the joint and they'll move it round and be able to tell whether it's lost movement and you've got decreased strength in it. And you may even hear and feel some noise, as we said, when they're doing that. There are no specific blood tests that can diagnose osteoarthritis, but you may be asked to take a blood test to rule out other diseases. Usually what happens is you'll get an X-ray or an MRI taken, and that will be able to show the damage within the joint. There are a number of things you can do to assist your osteoarthritis. It can be from simply taking paracetamol or a simple pain reliever if the joint becomes achy in the early stages. But as it progresses, you may find you need stronger medication, and your doctor or your pharmacist can give you some advice around that. Your doctor may also prescribe some anti-inflammatories for you, and he may also suggest that you have a steroid injection into the joint. You may also take some form of exercise, because exercise has been shown to be very beneficial. And before you did that, it would be useful to see a trained health professional such as a physiotherapist who will give you some advice about your appropriate form of exercise and something that doesn't hurt your joints. They may also advise that you take up swimming or get involved in a number of hydrotherapy classes that are around the country in different pools that specifically deal with people with arthritis. Gentle walking can be very useful, as well as gentle exercise classes such as Tai Chi have been shown to be useful. Because what you're trying to do is maintain your strength and flexibility around the joint and improve your aerobic capacity, because this maintains and helps maintain your normal movement. It helps decrease pain and stiffness, increases your muscle strength, and maintains your overall energy and well-being. And more importantly, it can help maintain your weight or help reduce it, which is also important because that takes the stress off the joint. If the joint becomes sore at times, you may find that even simple things like a hot pack or a wheat pack are useful to put on the joint. But if you've damaged it or jarred it through some ways, you may find that to help it, if it becomes inflamed, that a cold pack or ice pack is useful. Eventually you may require surgery, and your health professional will refer you to an orthopaedic surgeon who may suggest that a joint replacement is what is needed at this particular stage. And a number of sufferers from osteoarthritis also use complementary medicines such as osteopathy or acupuncture and other remedies that have been shown to have some effect with arthritis. I've got a personal experience of osteoarthritis. I developed symptoms in my mid-40s when I was running marathons as my sport, and I developed a pain in my hip and had it diagnosed and had a feeling that it was osteoarthritis. And over the next 10 or 12 years I managed my arthritis by modifying my activities. At that stage I stopped marathon running and I became more involved in cycling and swimming. And then 2 years ago I had a hip replacement because the pain and discomfort got so much that it was affecting my quality of life. And since the hip operation, I'm pleased to say that I've taken up lots of the activities I hadn't been able to do, such as walking and tramping and other activities, and my whole life has turned around because that pain isn't there that used to be there.